My name is Brianne Spade. I am a junior health science major with a focus in health and human services. So with the class of health communication, we were assigned to create a brochure just to give advice to biological parents, foster parents, or adoptive parents who have children who are addicted to opioid drugs, which Kentucky is also facing a health crisis with the opioid epidemic that is going on. So with this project, I did a little research of just seeing what opioid drugs are, because some people just don't know what they are, or they are maybe confused with the different drugs. And also finding out that the actual name for the withdrawal of what the children go through is neonatal abstinence syndrome, which is short for NAS. So this is my brochure that I made. So caring for children addicted to opiate drugs. And at the bottom there is a statistic. So between 55 and 94 of babies born to mothers addicted to or treated with opiates while pregnant may develop neonatal abstinence syndrome, which is, like I said, short for NAS. So I just also put here, some people, like I said before, don't really know what an opioid drug is. Some people, they can sometimes be confused as over-the-counter drugs such as aspirin and Tylenol, which they're kind of not in the same category as that. So they are a class of drugs naturally found in the opium poppy plant that works in the brain to produce a variety of effects, including the relief of pain. That is what most people use the opiate drugs for, is just the relief of pain. So here I did do a list of different opiate drugs, such as morphine is one of them, and they can use different ways they can use it is tablets, capsule, liquid, or injection, or people even do nasal spray. So here I have basically talking about neonatal abstinence syndrome. So I talk about what it is here. Also, there's the symptoms of it, 3 ways to treating NAS or testing NAS, and treatments of NAS, and just some long-term effects that children may have on the effect of the opiate drugs. So just a quick definition of NAS. It is just a group of problems a baby experiences with withdrawing from exposure to narcotics. So, and what most parents don't understand, that the risk of contracting HIV and AIDS is really high in this situation because of using IV drug users, well, such as IV drug users, and can affect the baby with low birth weight and also birth defects that the babies may have. Just to figure out like how the baby maybe will have NAS is just the 3 different ways which they can do a neonatal abstinence scoring system, which basically is a test of the different symptoms of NAS, such as seizures, yawning, diarrhea, dehydration, sweating. They can basically tell the doctor how severe those symptoms may be in the baby to determine if they do have NAS. So certain treatments that babies can use, usually suggested by the doctor, can also be some babies just are real irritable when and have a hard time being comforted. So mothers or the parents can swallow their baby just to make them more comfortable, or also they can be prescribed a dosage of drugs just to help them deal with the withdrawal of being addicted to opiate drugs. But so as it gets controlled, the doctor may wean the baby off the drugs, so just that they don't get addicted to it. And also with infants and newborn babies, they can be drinking a high calorie baby formula, which can help with more calories to help the baby grow, and since they have trouble feeding or just slow growth. Also, some long-term effects of NAS can be babies can have poor fetal growth, like I said before, delayed learning disabilities, and lower IQ in children. So as children get older, their learning disabilities start to grow more, which can affect them with their IQ level. Also with maybe them being put back a grade or being held a grade, or just having the learning disabilities that they have because of the effects of the opiate drugs. Or what people don't know is they have high risk for developing ADHD or even AND, which is the autism spectrum disorder, which can be affected to compared to children who were not exposed to the opiate drugs. So just with all that being said, parents should really be aware of the different information that goes on with dealing with children who are addicted to opiate drugs. I believe that if it's not my pamphlet or just different pamphlets should be given or being able to have access to them within doctor's offices or just hospitals, just so they can get a better understanding of what babies are dealing with when they're addicted to opiate drugs. Doctors should be able to also provide them with more information, so therefore the parent can be more prepared on what they could do or just different ways to be able to help their child to the best that they can. So just with that being said, according to the National Institution of Drug Abuse, the numbers of babies born with NAS leaped 5-fold from 2000 to 2012, affecting an estimate of 21,732 infants. So that is a very high number for children who actually deal with opiate drugs. Newborn babies are at risk. So every 25 minutes, a baby is born suffering from opiate withdrawal. So parents should be aware, mothers, when they are doing these opiate drugs, they should be aware of what their baby can go through while they are doing this. And on the back, I did put services for substance abuse disorder. So these are just different services that are around the country that can help mothers who are addicted to opiate drugs. Thank you.